Emergency care and resuscitation involves rapid assessment and early intervention. Approach to emergency care and resuscitation needs to be systematic, and that is why we use the ABCs approach, in which we assess for airway, we assess for breathing, and then we assess for circulation of blood. Now, the ABCs approach provides the framework, the solid framework for evaluation and treatment of severely ill patients. This begins with a primary survey. So, first of all, it is very important for us to assess the airway in order to establish patency or clear passage through the airway. Now, in order to do this, we have to look for signs of airway obstruction, which might include trauma, swelling, secretions, and the presence of foreign body in the airway. Now, this is followed by listening for abnormal sounds like stridor and snoring. If there are signs of airway obstruction, it is very important to intervene by positioning, opening, and clearing of the airway. This can be done by performing a maneuver called the chin lift maneuver. Another maneuver that can be performed is the jaw thrust maneuver. But if it is suspected that the patient might have a cervical spine injury, then it is recommended that we use the jaw thrust maneuver instead of the chin lift maneuver. Suction is also performed in order to remove secretions out of the airway. Airway adjuncts like oropharyngeal or nasopharyngeal airway can also be used at certain times. It is important to reassess the airway after performing every intervention. Some patients may require use of advanced airway techniques or devices like endotracheal intubation or even a surgical airway. Upon completing airway assessment and intervention, it is very important to assess for presence of breathing. Signs of a respiratory distress include tachypnea, hypoxia, cyanosis, apnea, and abnormal breath sounds. It is recommended to provide oxygen when oxygen saturation is below 92% or when the patient has dyspnea. Oxygen can be administered using a nasal prong, simple face mask, non-rebidea mask, or an ambibag. Now, the next step is to check for a central pulse, not more than 10 seconds. If the central pulse is absent, then it is very important to start cardiopulmonary resuscitation. You must assess for signs of poor peripheral perfusion, such as cold extremities, prolonged capillary refill, or a dry mucous membrane, and sometimes hypotension as well. Very important. If there are signs of a shock, then it is important to establish 2 intravenous large bore cannula and give intravenous fluids like crystalloid bolus. It is recommended to give 2 liters in adults and 20 milliliters per kilogram in pediatric patients. It is also important to limit fluids in individuals who are suspected to have a heart failure or renal failure, or even in children who are malnourished. Disability must also be assessed. This involves rapid assessment of the neurological status. This includes assessment for the level of consciousness using the Glasgow Coma Scale, signs of convulsions, random blood glucose level, examination of pupils, and also the presence of focal neurological deficit. Interventions that can be performed during the disability assessment include correction of the hypoglycemia, airway protection, stopping the convulsions by administering anticonvulsants, among others. Now, it is very important or necessary to fully expose the patient and rapidly assess for body signs of trauma, rashes, and sometimes infection. Now, after assessment and stabilization of the airway, breathing, and circulation during the primary survey, focus is now turned towards the secondary survey. The secondary survey is actually a systematic assessment of the rest of the body in order to identify injuries and illnesses. Common approaches that we use in doing this include the head-to-toe assessment or even the organ system-based assessment. If the patient condition changes while performing a secondary survey, then you must stop immediately and redo the primary survey and also the necessary interventions. The recommendations and pharmacological treatment discussed are based on a particular jurisdiction and may vary depending on the setting. Thanks for watching.